Understanding itching in the elderly. A warning sign for underlying health issues. Have you ever seen your father or elderly grandfather constantly scratching their arms, legs, or neck and simply attributed it to dry skin or an innocent habit? It's easy to dismiss these small observations when the person themselves doesn't complain much. But what if that seemingly harmless itch is actually a sign that something deeper is happening inside the body? In my years of working with older adults, I have discovered that an unexpected itch is sometimes the first clue that the body is trying to say, "Pay attention." Too often, families only start taking these signs seriously when the situation has already turned into a much more complicated health issue. In this discussion, I want to highlight 5 specific areas of the body where persistent itching can serve as an early warning sign of something important. Whether you're a family caregiver, a healthcare professional, or simply someone concerned about the well-being of an elderly loved one, recognizing these signs early can make a big difference in ensuring timely and appropriate medical intervention. Why we should pay attention to itching in older adults. You may wonder, don't older people often have dry skin anyway? That's true. Many seniors experience dryness due to slower skin cell renewal, reduced oil production, and lower hydration levels. However, there is a big difference between mild, occasional itching and a recurring bothersome sensation that disrupts daily life. When an elderly person scratches the same spot repeatedly, it could be the body's way of signaling underlying issues such as nerve compression, poor circulation, or organ-related problems. Understanding these signals can be life-saving, as ignoring them might allow a manageable condition to worsen into something far more serious. 1. Legs and feet, more than just dry skin. Common situation. Imagine your grandfather sitting in his favorite chair, absent-mindedly rubbing his calves and feet every few minutes. You may have noticed that the skin in that area looks a bit flaky or even slightly discolored, but you assumed it was nothing a little lotion couldn't fix. However, chronic itching in the lower limbs can be a sign of something more than just dryness. Possible underlying issues. Poor circulation. As people age, it's not uncommon for the heart to work less efficiently, reducing blood flow to the areas farthest from the heart, like the feet and lower legs. This decreased circulation can cause dryness, tingling, and itching. If you also notice changes in skin color, such as a bluish tint or slight brownish discoloration, it could mean that the tissues are not receiving enough oxygen or nutrients. Diabetes and hypertension. People with diabetes, high blood pressure, or both are more prone to circulatory problems. Itching might be the first sign that circulation is deteriorating. Risk of serious complications. Chronic poor circulation can lead to more severe issues, such as persistent wounds or even peripheral artery disease. That's why it's crucial to pay attention to the frequency and intensity of itching in these areas. What to do? Encourage your loved one to mention this symptom to their doctor, especially if there is any discoloration, swelling, or pain in the legs or feet. Suggest gentle massage or compression socks if recommended by a healthcare professional, as they can improve blood flow. Watch for sores, temperature changes, or persistent swelling. 2. The back of the neck. Don't overlook spinal and nerve health. Common situation. Have you ever seen an elderly relative tilting their head from side to side, trying to reach that spot on the back of their neck that they can't quite scratch? They might do it several times a day and shrug it off when asked about it. However, chronic itching around the neck area can indicate potential spinal, nerve, or muscle issues. Possible underlying issues. Nerve compression or spinal problems. Over time, spinal discs can degenerate, causing pinched nerves. This may manifest as tingling or itching rather than direct pain. Postural strain from technology use. In today's digital world, hunching over a phone or tablet isn't just a problem for younger people. Many seniors also spend a lot of time looking down to read or browse social media, straining their neck muscles and spinal alignment. Arthritis. Osteoarthritis in the cervical spine can contribute to nerve irritation. The itching may be accompanied by headaches or a reduced range of motion. What to do? Encourage posture awareness and small posture-correcting exercises. Sometimes, a physical therapist can teach simple stretches to relieve nerve pressure. If the itching is accompanied by persistent headaches, arm numbness, or limited neck mobility, it's definitely time for a medical evaluation. Don't assume it's just stiffness. Gentle remedies like warm compresses or supportive neck pillows can help, but if the problem persists, consult a professional to rule out spinal conditions. 3. Chest and upper torso. Clues about heart and respiratory health. Common situation. Imagine your mother constantly adjusting her blouse because the front of her chest feels itchy or irritated. She might mention that it gets worse in the evenings when she's relaxed or when she's a bit stressed. Possible underlying issues. Heart problems. In some cases, the body tries to warn us of underlying heart issues through subtle symptoms like persistent itching in the chest area. Lung or respiratory signals. When the lungs are under stress, perhaps due to mild asthma, chronic obstructive pulmonary disease, COPD, or other respiratory issues. The sensation in the chest area can sometimes manifest as itching or tightness, rather than the more recognizable shortness of breath. Changes in blood flow and pressure. If the itching worsens during physical exertion or stressful moments, this is especially revealing. The body may be responding to fluctuations in blood pressure or other internal changes. What to do? Pay attention if the person experiences shortness of breath or palpitations along with the itching. Observe if certain positions, like lying down, or times of the day make it worse. Seek medical advice without delay. Chest-related issues always require immediate attention. Conclusion: early detection can save lives. Itching may seem like a small inconvenience, but in elderly individuals, it can be the first sign of a more significant health issue. By paying close attention to where and when an older loved one experiences chronic itching, we can take proactive steps toward preventing more serious complications. By recognizing the signals the body sends, caregivers and family members can advocate for better healthcare and a higher quality of life for their elderly relatives. Have you noticed any of these signs in your elderly loved ones? Let's continue the discussion and raise awareness about the importance of paying attention to these subtle but meaningful symptoms.